So how is this ERA test done? The ERA test is usually done in a medicated cycle, meaning from day 2 of your period, you started on estrogen medication to develop your uterine lining, and you have to follow up for a ultrasonography. Once your lining looks good and is ready, you are started on progesterone medication. After 5 days of progesterone, normally at a time when we would have planned a frozen embryo transfer in the blastocyst stage, instead of doing the blastocyst embryo transfer, small tissue biopsy is taken of the endometrium, and that endometrial tissue biopsy is sent for the ERA test. The ERA test result typically takes 2 to 3 weeks to be ready, and the ERA report usually comes as receptive or non-receptive. If the ERA is reported as receptive, it means that there is no problem in the window of receptivity, and we should go ahead and plan the frozen embryo transfer as routine practice. If the ERA test report comes as non-receptive, they usually give a recommendation saying you plan the frozen embryo transfer 12 hours or 24 hours earlier or later. And then in the subsequent frozen embryo transfer cycle, we plan the timing of the embryo transfer based on the ERA result.